Myelogram. Introduction. Can you point to the vertebrae? Choose one of the following options. Correct. Can you point to the discs? Choose one of the following options. Correct. It is normal to feel pain during a myelogram, and you should not tell your doctor about it. Select true or false. Correct. Pain indicates the needle may be touching a nerve. Always tell your doctor if you feel pain, particularly pain in the legs. X-rays are safe during pregnancy. Select true or false. Correct. X-rays are not safe for unborn children. Therefore, you should tell the radiology staff about even the remotest possibility of pregnancy. A pregnancy test can be performed in case you are not sure. Infections are rare after this procedure. Select true or false. Correct. Infections are very rare after such a procedure. The iodine dye used in this test could possibly cause allergic reactions or kidney failure. Select true or false. Correct. These are very rare. Unfortunately, either of these complications could lead to death. It is therefore very important to tell your doctors about any allergic reactions you might have had in the past. You should tell your doctor if you are on metformin, also known as glucophage. Headaches, seizures, fever, and leg weakness are normal during or after myelography. Press true or false. Correct. These are the signs of possibly disastrous but rare complications such as fluid leak, paralysis of the legs, loss of bladder control, infections around the nerves and the brain. If left untreated, some of these complications can cause death. It is therefore very important to report these symptoms to your doctors.
Thank you for using Explain.